Hi, it's Mr. SV, and we are here in front of the Southern Arizona Veterinary Specialty Emergency Center. We are about to go interview Dr. King, who is a veterinarian specialist who works with animals. So this should be a very cool interview. King, who is in charge of running this animal hospital. And as you can see, Dr. King has got a cool friend with us today. Dr. King, who's the friend that we have today?
This is Comet. He's a rabbit.
That's very cool. I love his colors and I love his fluffy ears. Look at
He's
that.
a little Comet.
Awesome. He's so cute. And what are some of the things that you get to do? Look at his big old ears there.
Yeah.
What are a lot of your responsibilities when you are a veterinarian? You're an animal doctor, and you get to run a hospital like this. This is an emergency hospital. So what are some of the things that you do here at the hospital?
Yeah, so the main thing is that we look at animals that owners think that they're not doing well at
Okay.
home. And that's basically what classifies it as an emergency. Whenever an owner is concerned, they will bring in the animal.
Okay.
Oftentimes they're really sick, oftentimes they're not as sick, but on emergency we see all the things that aren't right.
Okay. And what are some typical things that owners bring their animals for? So we have dogs, cats, rabbits, obviously. Are there any other animals that come in as well?
It depends on the doctor that is working, but we will see anything as long as the doctor's comfortable with it.
Okay.
So I've seen horses and donkeys and sheep here as well.
Wow. I didn't know
We have a
that.
back patio back there where they can hang out and the trailers can come out too.
Oh, that is really amazing. And how many people do you have working for you here?
So tonight I am very lucky. I have two nurses that are helping with intake of animals. So whenever the animal comes in, then the nurse takes all of their vital signs like their heart rate and respiratory rate and weight and temperature and records that for me. So I have two nurses doing that, and then I also have a nurse that monitors all the hospitalized patients. So we're a 24-hour, 7 days a week emergency hospital, and that means if a patient isn't doing well, they can stay in the hospital. And so I have one nurse that makes sure that all those patients in the hospital are doing well.
Oh, that's super, super awesome. So if families are having trouble with their pets, they can come to like a hospital like yours,
Yep.
and they can just to see if it's an emergency, just check them out and make sure they're okay. That's
Yep.
awesome. Now I noticed there's a lot of animals here. Do
Yeah.
you own animals as well?
Oh, I do. I have 10 horses
10 horses. Wow.
and one dog,
Okay.
two cats, and um, 12 sheep and 8 cows.
Wow. That's a lot of
I think
animals.
that's all.
That's pretty awesome. That's awesome. Um, what is your favorite part of your workday when you come to work here? What's your favorite thing to do, or when you leave here, you feel like you've done something really cool? What's probably your favorite thing about your job?
I think definitely seeing a patient that was sick coming in and leaving feeling better, that is the best part.
Okay.
Yeah. And making sure that the owner is happy, that they know that their friend will be okay.
That's great. That's
Mhm.
awesome. If you could give advice to elementary students who maybe are learning about a job like yours, who's a
Mhm.
veterinarian and an animal doctor, what kind of advice would you give them so maybe someday they could be sitting here holding a rabbit and interviewing as they're a doctor and running their own hospital? What kind of advice would you give them, even if maybe they're 5 years old, maybe they're 8, 9, 10 years old? What kind of advice would you give to them?
I would just say every day that you are faced with an opportunity or something that you do, if you if you realize that it has to do with animals and you really love it, then keep going that route. Just treasure that moment and know that that's what you want to do. Just keep that little dream alive.
Oh, that's great advice. One animal when you were a kid that was your favorite. Can you
Uh,
remember one? I'm sure you've had a lot.
it would be dairy cows because I grew
Oh,
up on a dairy farm and my mother made me chase all the dairy cows into the milking parlor.
Okay.
So I just grew up in and around and under dairy cows.
Oh, that's so cool. Awesome. Well, thank you, Dr. King. We really appreciate your time, and we really appreciate you giving advice to our Carrillo Cougars.
Do you have any questions for me?
Um,
You?
yeah, what we're gonna do is get a tour so we can kind of see what this is like. So we're gonna say goodbye for now, and then we were gonna have one of Dr. King's nurses or someone who helps here at the hospital, and they're going to give us a little tour. We're going to see, and you guys can say goodbye to Comet. And as you can see, Comet,
Goodbye.
thank you for doing a great interview, Comet. We appreciate it. All right.
With your principal, and he's going to walk around the hospital.
Well, working to be principal is Mr. SB, and now I get to walk around with Comet. Isn't this cool? He is a super cool rabbit. Very fluffy, very calm. He's allowing me to hold him, which is super, super awesome. All right, King, as you can see, we have a new rabbit, and we don't have a name for him. And look at that cute, adorable face. Oh my goodness. So for now, since we don't have a name for him, and our mascot, you guys could also name him kinders, first graders, second graders, whoever's watching the video today. You guys can give him any kind of name you want, but for today, we are going to call him Carlos, just like our mascot, Carlos the Cougar. All right, Dr. King, you want to lead the way and show us around your emergency room here?
That one.
As you can see, we have a lot of
This is
people.
Dr. Tuttle. He's one of our resident doctors who does pretty much everything. He's a new graduate.
That's super cool.
He graduated from
Washington State. That's awesome. So Dr. Tuttle, so I am Mr. SV from Carrillo Elementary School, and we're giving a tour of our Carrillo students of the veterinarian place here, and just kind of showing what it's like to be here. So no, we're not live.
Oh.
We're just videotaping, but yeah, we're just kind of walking around looking at the different facilities here. So that's awesome. So what do we have here, Dr. King?
This is a little chihuahua, and his name is Fido-Lice.
Oh, Fido-Lice.
And,
Oh.
He actually belongs to one of our staff members.
Okay.
Let me. And my staff member is a PCA, which is like a patient care assistant.
Okay.
So they actually have all the love for the patients, and they take care of the patients.
Oh, that's so
while they're in
cool.
hospital. Let me see if he's available.
He is actually going to get to come out, and you guys get to see him here. He is adorable. And why is he here today?
He just comes to work with me every once in a while.
Wow. So a dog that gets to come to work at the dog or at the animal hospital. Wow. So he gets just to hang out with and maybe make all the other dogs and maybe even cats feel a little bit better.
Oh yeah.
Oh, that's so awesome. Well, he's very cute, and it's great to see him here. Thank you so much for showing him to us.
You're very.
Hospitalized patients. You guys can see that this patient actually just had a surgery today. Okay.
Oh yeah, and you can see he's got the little blood drawn from his hand there, or his little paw there.
Yeah.
Okay, and
So he had a surgery, and this little line right here.
oh, I see that. Okay,
Going up.
and it
out
goes
of the
right into
tunnel.
here, right? And what does this thing do, Dr. King?
Yeah, so this is what we call a fluid pump, and the fluid pump is giving our patient 110 milliliters of fluid every hour
Okay.
to help hydrate that
So
patient.
kind of like putting water back into his
Yeah.
system. And is he recovering pretty well?
He's recovering really well.
Oh, that's good to hear. Oh, okay, he'll be better soon. All right, Cougars, listen.
His name is Braveheart,
Oh, Braveheart.
and
And what
He's
what did he have done here?
he is having difficulty urinating.
Okay.
So we're just you can see on this patient that there are two lines.
Oh, I
There's
see.
one line here,
Okay, there's one there.
and there's one line there.
Okay.
So this patient actually he couldn't urinate. His bladder was blocked.
Okay.
So what we had to do was put in a little catheter and made him able to urinate.
Okay.
Look
Okay.
at him. And I'm gonna come around.
And how's he recovering so far? How's he
It
doing?
looks like he's doing pretty well.
Oh, that's
So,
good.
The front portiere, that is the port where his fluids are going in to help hydrate him.
Okay.
And then this last port, the portiere by his pee-pee area, that is for his urine to come out.
Okay.
So then we collect his urine and
And
that
it goes all the way
fluid
down
bag
there.
down there. And you
Oh.
can see it kind of looks like
Oh, yeah.
urine or
Yep,
pee.
you could see it. Okay, well, we're helping him here to be better and healthy.
Yeah.
All right, we hope.
Patients, his name is Benny. And these are my awesome nurses, Rachel and Jason. And they're
Awesome.
taking what we call a blood pressure, making sure his pressures are normal.
Okay.
So then he has a little cuff on the end.
Oh,
and then
okay, I can see
you can
that.
see the little
So they're just making it.
sphygmometer.
So they're just making sure his blood pressure is good
Mhm.
and he's healthy. Okay, that's great to hear.
And Rachel is also amazing. Oh, I don't know if we're still. Rachel is amazing. She takes care of all the hospitalized patients overnight.
Thank you, Rachel, for everything you do. We appreciate that. All right, Cougars, make sure you give her a nice round of applause and a nice hand. And then we have
Kara.
Kara here. Okay.
Another one of my nurses.
Okay, great. And you guys are working with the rabbit
Another
here?
rabbit.
Yeah, we're just getting their weights and their vitals because we're gonna neuter all of them.
Okay, so if you like rabbits, you can bring your rabbits here to the vet hospital, okay?
Yeah.
Look how cute he is. And he's going to go back into his little house? All right, there he goes. Good job. And Bella is a big bulldog. And Bella had what the doctors think was a seizure, where the dog shakes and shakes and shakes and then kind of lays on the ground. And her parents brought her in so she could just rest and get checked. And so far, as you can see, she's asleep and she's doing good. So let's keep sending good thoughts to Bella's way and hope she gets better, okay?
The lab and our pharmacy. So follow me. You guys can see a bunch of fancy machines here. This is where we do all of our blood work. So we collect some blood from a patient, and we spin it down, and then we collect a little sample of the top, and we can run our blood work.
And does that help you determine what's wrong with the animal that's here?
Yep, exactly.
Okay.
So, running these tests on these machines can help us identify if there's any abnormalities like infections or changes in electrolytes or any of that.
Okay, great. Okay.
And then we use our microscope a lot. You guys might even use microscopes.
Not yet. No, we haven't used. I think they don't use those until they're in middle school.
Okay.
Yeah, but this is science. So if you like science, you're gonna love looking at it on a microscope and learning about the different machines and how they work, and that's really cool.
So once we get our blood done, we often make a stain, and we can see all of these little blood cells under the microscope.
Okay, and what's this cool little machine doing here?
Yeah, this is just a rocker, and it just keeps the blood from clotting, so we can
Oh.
have a nice fresh sample.
Okay, that's really neat, Dr. King. Okay.
And then, of course, we wouldn't be able to do our job without a ton of medication. So this is our little pharmacy.
Wow, so this is all the medicines for all the animals here.
Yeah, well, some of them that we have in the hospital.
Okay.
Like, for example, you guys might know this one. Maybe you guys took it when you guys were little because you had an ear infection. It was amoxicillin.
Okay.
And that's an antibiotic.
Okay. So wow. Okay. So the doggies get medicines. The cats get medicines, just like humans
Just
do,
like
so they can
humans.
get better. Okay.
Yep.
That's awesome. Well, thank you so much for showing us your.
This is kind of a dark room because this is our X-ray room, so we take radiographs. And this was a patient that we just did X-rays on, and you can see the bone right there is very curved, so that's abnormal. The bone should be nice and straight.
Oh, it is curved. Okay. And so what happened? Did the bone break or
Yeah,
did?
this was a fracture that they fixed.
Wow. Okay. So they have an X-ray machine here. So if there's something wrong with the way they're walking or moving, you can take an X-ray and see what they look like from the inside. Okay.
Exactly. Perfect.
That's great. Of our tour, I hope you had a good time. I hope you learned something neat. I hope to come back and talk to Dr. King again. So if you have any questions, ask your teachers, and guess what? They will email Mr. SB, all right? All right, so long, Cougars. Keep learning. You guys are awesome, and you guys are A+ students. All right.